potential, or the Ebola outbreak as it is currently reported in DRC and Uganda, how prepared are we as a country to handle any potential risk?
Good morning, and thank you very much for that question. As a country, we have been able to ensure that testing is taking place. And as of yesterday, we had 22 cases that have been tested and confirmed that they are negative. Mm-hmm. Number two, we have beefed up surveillance and also enhanced the manning at the border points, just to ensure that everybody who is coming into the country is also getting screened. And we are also getting, for the planes that are coming into Kenya, we are testing our wastewater. We are doing surveillance on the wastewater, the aircraft wastewater, to ensure that we also get the patterns of the diseases that may be coming into the country. And that includes diseases like polio, cholera, meningitis. And we used to do for COVID. Now we are going to join Ebola into it. Equally, our healthcare workers, we are continuing to train them because training is a continuous process. Mm-hmm. However, we already had those who had been trained initially, so they are all set, and we are ready to deploy them to the ground.
All right.
Therefore, as a country, we are very, very alert that on anything that might happen.
Right.
We are also happy with our neighbors and especially the countries that have been affected because we have communicated with the authorities to ensure that the exit management is done properly. We need people to be screened when they are exiting and equally when they get into our country.
All right.
The incubation for Ebola takes between 2 days and 21 days. Mm-hmm. Therefore, it would also be important that a second test, probably after some time of your travel, is done, just to ensure that everything is cleared.
All right. Madam Principal Secretary, the other question is on communication. Many people, many Kenyans are in a panic because of other news, and the Ministry of Health does not appear to be forthcoming with a lot of this communication to the common wananchi. Is there anything you're doing to change this?
Yes, risk communication is ongoing, and we ourselves and our partners, we are coming all out. We are finalizing on the pictorials, including those that are going to be taken to the airport and also to the health facilities. We are also engaging, like what I am doing right now is communication. Mm-hmm. Yeah, we have our directors who are also who are going on TV stations to ensure that they are speaking to the members of public. We are creating public barazas, small public barazas and focus group discussions to also show and to also explain to Kenyans what exactly Ebola is, what are the signs and symptoms, and how can you get assisted, where can you get assisted, what contacts you should call in case you get unwell, or if you need to know any kind of information. For instance, our number that we have, we are giving out for any Ebola cases is 719 for the country.
Toll free.
Yes.
All right. Final question. In your own estimation, what level of risk are we as a country? Because we understand Kenya has never reported any confirmed cases of Ebola.
Sorry?
In your own estimation, what is the level of risk that we are at as a country, since we have never recorded any single case of Ebola?
Yes, indeed. We are at a high risk, if I can put it that way. We are among the countries that have been mapped out as a high risk because of the proximity of our neighbors. It is good to note that Uganda has already reported 10 cases and they have 1 death, while DRC Congo has reported more than 100 cases and actually more than 100 deaths. So because of the proximity, and pathogens have no boundaries, diseases have no boundaries. we need to really enhance our surveillance just to ensure that we are ready and we are able to pick the issues before they escalate. Also, our laboratory capacities have already been strengthened. Remember, during COVID, you would go to a clinic and your samples are taken. They are taken to South Africa or the UK or India. They would take days to come back when you're still quarantined. But right now, we have the capacity to test from our country. In fact, in 6 to 8 hours, you will get your test results. Therefore, the capacities have been enhanced, and that is a plus for us to show the preparedness. The other issue of case management capacity, Moi Teaching and Referral Hospital has a fully operational 20-bed ICU-grade isolation unit equipped with a heating, ventilation, and air conditioning system.
Okay.
And also an additional 30-bed capacity that can rapidly be adapted to support a surge case or a management, if case management needs. Therefore, there's a lot that is happening in the background, but I also want to ask the members of the furthest seat, please help us with the right communication to the members of public. Let us not politicize the issue of health.
All right.
Because this is we are at a very critical time, and I want to pray that the members of the furthest seat are going to be with us, not against us. Right. I pray that you speak my language so that we are able to help the members of the public.
Thank you so much, Madam PS, for your time and spending a few minutes to talk to us on this issue of Ebola. All right, that has been PS Muthoni Muriuki, State Department for Public Health and Professional Standards, talking to us about the preparedness that we have in as far as Ebola outbreak is concerned. And that's what we've been talking about here. I cut you short, so probably you may want to react to what the PS has said briefly with regard to preparedness, Bill, as we wrap up the show.
Yeah, no, I'm happy that even we got a chance to hear from the Principal Secretary, because as we were saying about communication, these are the platforms they should be on. And you really need to communicate to healthcare workers primarily, because those are the people who you need to execute whatever you're saying. So if we do not believe in what you're trying to accomplish, that's where you really cannot carry out any program unless the executors also believe in. So even to the Principal Secretary, I'd just say engage healthcare workers, engage the unions, engage, because they are the ones who will carry your message far and beyond anything you can do on daytime television.
All right. Thank you so much, Dr. Bill Muriuki, Chairperson, Nairobi, Kenya Medical Practitioners and Dentists Union. Asante sana for your time. Also, Brown Ashira Olali, who's the General Secretary and CEO of KEFU. And KEFU, once again, is a long one. Kenya Environmental Health and Public Health Practitioners Union, KEFU, with a silent P. Yes. Asante sana for your time.
I had 1 second to say something to
15 seconds only.
PS Muthoni. I don't know which plans does she have. You know, you're talking about mambo preparedness. And part of preparedness is also employment of public health officers at the cross borders. I also want to implore to her that she also should be, the parliament should pass a budget, a budget to be able to make sure that we beef up security and employ more PHOs and more doctors and more nurses at the border, so that we can be able to limit diseases. And also, please, let's finalize on the deal of the UHC. Our UHC colleagues are actually on our neck. They need those permanent and pensionable terms so that they can be able to get it. There's not to be a country that projects diseases. We need to prevent.
All right.
Thank you.
State of health has been the discussion, of course, with a huge focus on Ebola, the Ebola outbreak, which has been declared a public health emergency with an international concern. Asante sana, Brown Ashira Olali and Dr. Bill Muriuki for that. After the break, we switch to matters relationships. The rise of singlehood. Is it by choice, circumstance, or simply fear of commitment? Yeah, that is what Arno Dida and a panel of young Kenyans will be discussing after the break. My name is Freddie Ndimuli. Good morning.